So it's not enough to inform people, to tell them that the vaccine is out there. You actually need to work the communities. You need dialogues to be happening in every community.
Our health systems have been set up to be paternalistic, that the health worker knows it, and whatever he says, the community side will just accept. I think that we need to change that.
In health promotion, we learn that we need to deeply involve ourselves and immerse ourselves with the communities. First, appreciate that communities are diverse and communities have their own social values, their social norms, they have beliefs, and they have structures. So once you unearth that, you are good to go with communities.
Because even if you have all the plans, the beautiful plans and strategies, and you don't enter a community properly, you have resistance.
When you talk about reproductive health, it's not just about HIV prevention, contraception, but for them they were like, reproductive health also includes livelihood, social protection, housing.
So when capacity building takes place, not just at the level of the physicians, but goes all the way down to the frontline health workers, because at the end of the day, it's the frontline health workers who are consistently with the community, because they don't come in and leave at the end of the day. They live in the community.
So we bring young people together to exchange that peer-to-peer knowledge, on how we can navigate on issues related to reproductive health. So we let young people talk to each other, and then we integrate with other issues.
Our main target would be the parents. Audience would be the parents, and again the close relative. But again, we would fall back to our religious leaders and other ambassadors to make full utilization of there and communicating in the simplest possible way that this vaccine is there to prevent a cancer, and it's a very, very unfortunately important cervical cancer which is there, and we want to finish off this menace.
The communities themselves, the women groups, the youth groups, all those need to be informed, and I love working with them and seeing the changes. They need to get information, we need to give them the information, and we need to listen to them.
And one thing that I've always brought on board is to map the cervical cancer survivors. Support them emotionally, support them through treatment, and when they are ready to tell their stories, bring them on board as advocates for the HPV vaccine so that they can tell their stories, they can tell the challenges they've gone through, they can talk about the screening, the treatment, and the care, and the emotional and psychological support to where they are now.
We need to be on our A game to ensure that the communities are well primed, that the concerns are surfaced and addressed as they're being surfaced, and that that the government is fully supported as they plan to roll the vaccine out.